This is Understanding Procedure Coding, a work text. This presentation is over Chapter 15, Maternity Care and Delivery. So basically in this chapter, in this presentation, we're going to be looking at procedures performed during maternity care and delivery, and we basically call this obstetrics. And when we're looking at this, we are focusing on your antepartum services, your delivery services, and your postpartum services. Okay? And one thing is interesting to note here in terms of billing. The way they do this is you usually have one code that covers all those phases or components, and definitely like your antepartum services, they are usually included. You usually don't bill for those. They are all built into your delivery services, and all of that goes together. We call that a global service, where it's taking the whole thing in its entirety. But then you will notice here we have the sections out. So we have a section called antepartum services. So there are times maybe where one doctor does not do the whole thing, and then this is where we get into the separate coding, where it becomes a separate service. And you're going to notice that. The other thing you also need to know is what are we referring to when we say antepartum, postpartum, and delivery. What is those separate components, what they represent. Okay, so you have to pay attention, make sure you read your chapter, because it's going to address those items or those concepts. Alright, so if you go to your coding manual as usual and flip over to our maternity care and delivery, that came in right behind your male and female genital systems. And let's look at see what's going on here for our coding for the procedures in this section. So under maternity care and delivery, you'll notice right off there is a lot of coding notations, and it's pretty much going into what's included in those different sections as I was talking to you about. For example, I'm not going to read through all of that, but like in that second paragraph under maternity care delivery, it tells you that antepartum care includes the initial and subsequent history, physical exams, recording of weight, blood pressures, fetal heart tones, routine chemical urinalysis, and monthly visits up to 28 weeks gestation, bi-weekly visits to 36 weeks gestation, and weekly visits until delivery. Right? So that's already cluing you in as to, if we're coding here, what is being included in that code. So with our antepartum services, beginning with that code 59000, we're looking at different services that are occurring during the time prior to childbirth, and more or less we're talking about that prenatal care. Now there's certain things that may need to be coded separately, but then there are also procedures that you're going to normally see during that prenatal time period. Alright? And as I was telling you again about the reimbursement, usually they don't have reimbursement associated with your antepartum codes when the physician is doing the global service, or they're doing all of the services provided to that patient. Your book also tells you about how long that prenatal care occurs and how frequent that thing occurs, but this is going to include all the way up until time for delivery. Now, in your coding here, you see codes for procedures like an amniocentesis, a chordocentesis. These are different procedures where they're maybe trying to gather some examination about the health of the child and those types of things. You got chronic venous sampling here, fetal stress testing, fetal scalp blood sampling, fetal monitoring during labor. You have those codes starting at 59050 there. And you see your code separated there by supervision and interpretation, and then you have a code just for the interpretation only. You have your transabdominal amnio fusions, fetal umbilical cord occlusion, fetal fluid drainage. All of these are under your antepartum services. Fetal shunt placement. All right? Antepartum. This is when the physician is not doing a global service, and you will probably be reporting a couple of codes out of this section. From there, you have excision codes for under your antepartum services. You have a hysterotomy, and it says here for, like, for example, a hydatidiform mole, right? And those are cysts. That's really the ova that cannot develop properly, your book tells you. And before I keep going any further, I meant to bring your attention to, in your textbook, to figure 15.1 and showing you an illustration of an amniocentesis. Alright, so you got a hysterotomy under your excision. We're back to excision. Hysterotomy, ectopic pregnancy. Procedures for ectopic pregnancies are here, starting with your code 59120. Okay, under your excision section. You have, after that, and you got different multiple things there going on with your excision for your hysterectomy. But after that, you also have a curettage procedure there at 59160 under excision. And then finally, you get to your introduction section. There's only one code there, and that's your 59200 for insertion of a cervical dilator. And after that, that's your one code. You go to your repair code, and that's going to conclude your procedure on your antepartum. Under your repair, this is where your episiotomies are. Anybody familiar with delivery? And we know that the episiotomy is that they make an incision there in your vaginal opening so that when you're delivering that baby, it doesn't tear. You also have here a code for a hysterectomy, for ruptured uterus. And then we have 59320, the circlage of the cervix. We have another code for that in a different section, but it was that code was for not for during pregnancy. So here's the circlage of the cervix for pregnancy. That's your 59320. Okay. Now, and I did not follow. Here's the slides for those. I kind of got ahead of myself. So here's your ectopic pregnancy, your hydatidiform moles, then your curettage, and then in the introduction, just kind of doing a brief review here, and then your repairs for your episiotomy and your hysterectomy. Okay, we'll bring you back up to date. I'm so sorry. Now, after that, so that's your antepartum, and that's when a global service is not being performed by that physician. This is going to take us to a section that's called vaginal delivery, antepartum, and postpartum care. And if you notice right under that heading, you see a coding tip, and it says the services normally provided in uncomplicated maternity cases include antepartum care, delivery, and postpartum care. We're talking about that global service. And you also notice under here, you have a couple of different sections. You have vaginal delivery, and you have cesarean delivery, and you also have VBAC. Okay, and we're going to talk about VBAC. So here in your vaginal delivery, if you look there, your code, it starts with your code 59400. It says routine obstetric care, includes antepartum care, delivery, and postpartum care. So that's your nice little package global code. And you notice the episiotomy and the forceps are included, so that means you would not code those things separately. Then you start seeing them break out. 59409, vaginal delivery only. Okay? 59412, external cephalic version. This is basically talking about breech pregnancies, and if they have to kind of manipulate the position of that baby so we can get their baby turned the proper way, because usually it's head down. If you can see there in the pictures. So that's what that code is for. Then you have a code starting at 59425. In the primary care, only 46 visits, 7 or more visits. Do you see that? Now, well, I was going to say something about that. Okay. So, I can't remember. I was going to tell you something about that, but I can't remember. So you got that, and again, this is for normal pregnancies, uncomplicated pregnancies, for those sections only. It tells you also that what you need to know when coding with that 59425 through 59426. If you got fewer than 4 visits, then you're going to use the E&M code. All right. Then you got 59430, which is for your postpartum care only, and you see that's a separate procedure code as well. From there, you have some similar coding, but it's for cesarean delivery. So if you notice in your coding descriptions here, it says routine obstetric care, including antepartum care, cesarean delivery, and postpartum care. All right. Then 59514 for a cesarean delivery only, and then you have an add-on code here if they do a hysterectomy. That's your 59525. Now your VBAC, that's your vaginal birth after cesarean, VBAC. He starts off there in your code 59610. So basically, this individual or this patient has had a cesarean, and then with their next birth, they're going to do vaginal. That's what that means. And so you will pull a code from this section, 59610 through 59622. If you look very closely here, those codes are divided by whether the attempt to have a vaginal delivery is successful or unsuccessful. Okay. Now, after that section, delivery after previous cesarean delivery, you see a small section here for abortion. All right. And it starts at your code 59812 through 59857. And basically, you know what abortion means. So they ended the pregnancy before a viable age. And there are several types. If you're looking at the coding descriptors, they're talking about different types of abortion. You got missed abortion, septic abortion, induced abortion, okay, incomplete abortion. So you got to know what you are coding for. Your book breaks down these different types of abortion. A missed abortion, fetus died before completion of 22 weeks gestation and retention of that fetus up to 4 weeks. Incomplete abortion, all the products of conception haven't been expelled. A legally induced abortion is elective or therapeutic abortion, so it's within the law. And a septic abortion means there's some kind of fever and infection present surrounding that abortion, which could be life-threatening. Spontaneous abortion, complete or incomplete expulsion of products, no conception before a pregnancy goes beyond 22 weeks gestation. So those different terminology or types of abortion are mentioned in your coding descriptors under your abortion section. Now from there you have other procedures, and one of the things they talk about here that stands out is that of MPR for multifetal pregnancy reduction. And basically that's talking about when someone has a pregnancy with multiple fetuses within their stomach, then what happens is if it is a situation in which all of them may not make it. There's a good chance of several of them will die, or all of them will die. They may remove some of the weaker ones so that the stronger ones can survive. Okay, and so that's called a multi-fetal pregnancy reduction, and that's your code 59866. Some of your other codes here: removal of circlage, suture, uterine evacuation, and curettage. And then you got several unlisted procedure codes for your maternity and delivery section. This is going to conclude our presentation on Chapter 15, Maternity Care and Delivery.